This has been an emerging area. We discussed this at ASCO GU with our poster presentation from one of our great trainees at MD Anderson, Dr. Carrier. We published our own institutional experience on metastasis-directed therapy for oligometastatic and oligoprogressive, both upper tract and bladder cancer, so urothelial carcinoma. These were patients that had 5 or fewer sites of metastases, in our current definition of oligoprogressive or oligometastatic disease, and treated in a modern cohort from 2016 to 2024. We had around 52 patients included in that cohort, and patients were receiving radiation to their oligoprogressive or oligometastatic sites with consolidative radiation. And in the majority of these patients, that was SBRT, highly ablative, very targeted radiation to sites of disease. We found a very impressive, this is basically just a retrospective cohort. We don't have a comparative group. However, the median follow-up was over 3 years. We found that the median PFS was on the order of about 20 months. The median overall survival for this cohort of patients was about 42 months. And you think about the current standard for many of these patients, this is oligometastatic, oligoprogressive urothelial carcinoma, and you think of EV Pembro as being our great comparator. This fits really well with that group of patients. We're doing, as far as kind of comparing it to our current standard of giving, enfortumab vedotin and pembrolizumab for patients with metastatic urothelial carcinoma, that overall survival matches very well. And that suggests that many of these patients in our cohort had to discontinue things like EV because of potential toxicity, had to discontinue things like immunotherapy, and were referred to a radiation oncologist for consideration of consolidative radiation to their oligoprogressive or oligometastatic sites. And we still saw an impressive overall survival. So I think that speaks to the fact that we are potentially underutilizing consolidative radiation for many of these patients. There's very limited data, mostly single institution experiences. At MD Anderson, we have not opened a randomized study called the Extend OP study, which is a randomized phase 2 study looking at oligoprogressive urothelial carcinoma, randomizing to both to next line systemic therapy, which is our current standard of care, versus same line therapy with the addition of radiation, with the end goal of trying to keep patients on their effective same line systemic therapy, but ablate those sites that are progressing in the interim. So that study has been accruing for over a year. We are accruing very well, and hopefully that will provide some of the first randomized data in this really important space.